The history of Earth is unimaginably long. If it were sped up to the equivalent of a single day, all of humankind, from the earliest skeletons to the invention of the iPhone, would have occurred in only the last 4 seconds. Dinosaurs were still roaming Earth about 20 minutes before that. But the creation of our planet occurred more than 23 hours earlier, 2 cycles on this clock, or 4.5 billion years ago. So if life were possible,
As 4.3 billion years ago,
it begs the question, how?
Imagine a world where every citizen, rich or poor, urban or rural, has access to instant, reliable healthcare advice. Imagine a system that reduces hospital burden, supports nurses, empowers patients, and saves lives without massive government spending. This is no longer a dream. This is the reality of Dr. Maya GPT, a revolutionary AI-powered healthcare solution developed by Dr. Kadiyali Srivatsa. Dr. Maya GPT is not just another AI. It is the future of healthcare designed specifically for nations that lack doctors, hospitals, and infrastructure. Many nations today face the same challenges. Too few doctors for growing populations, overcrowded hospitals struggling to handle the demand, people dying from preventable diseases due to lack of early intervention, fake doctors, and unsafe treatments scamming the poor, high healthcare costs that burden both citizens and governments. The current system is failing, and building hospitals or training more doctors takes decades and billions of dollars. But what if there was a faster, cheaper, and more effective solution? The world is changing. AI is revolutionizing healthcare, and the nations that act now will be the ones that thrive in the future. The question is, will your country be a leader in this transformation, or will it be left behind? If your nation lacks doctors, hospitals, and healthcare access, you have a choice. Implement Dr. Maya GPT now. Save lives, reduce costs, and empower your people. Or ignore it, and let your citizens continue to suffer in an outdated system. History will remember the leaders who made the right choice. Dr. Kadiyali Srivatsa has given the world a gift of knowledge and innovation. The decision to use it or ignore it is now in your hands.
I advise the user to speak, consult, or go to the hospital if the symptoms are red and not blue. If the symptoms are blue, I advise the user to isolate themselves, speak to a doctor, and not rush to the hospital or consult a doctor. I act like a health inspector, helping people understand what's happening in their bodies. Consider it as an engineer checking why your electricity isn't working or your house isn't heating correctly. With Dr. Maya's GPT, patients can 1. Save money by avoiding unnecessary doctor visits and tests. 2. Reduce antibiotic abuse and prevent superbugs. 3. Minimize exposure to infections in hospitals and clinics. 4. Empower themselves with knowledge about their health. 5. If the symptoms require specialist advice, I will advise them to contact the specialist, avoiding delay. There's no legal risk, no medical overreach, just an AI-powered assistant that helps people make better health decisions without referring them to speak or consult doctors or private hospitals. Why governments must act now? Hospitals, pharmaceutical companies, and doctors with financial interests will resist this change. But if we truly care about public health in your country, reducing medical costs, and preventing unnecessary treatments and delay in diagnosis, and offer the best healthcare advice or treatment, you must embrace Dr. Maya GPT. Please scan the QR code and ask me. I will share information and motivate you to be the one who took the lead. You can also reach me via website call111.com. Dr. Srivatsa created Dr. Maya to reduce disparities. Be the one to lead the world by implementing this ChatGPT-driven healthcare revolution. The future is patient-centered empowerment. Let the WHO and CDC know you are pandemic prepared. The world is still stuck in outdated ways of thinking about healthcare. However, our collaboration with ChatGPT is 30 years ahead of time. The question is, will you wait or will you lead? Scan the QR code to learn more about Dr. Maya GPT. I am looking forward to hearing from you soon. Thank you.